Hey there, I'm Mike.
And I'm Matt.
And I'm Jody. The Wild Health Podcast is our quest into human performance, longevity, and personalized medicine. Together, along with experts in these fields, we'll learn how to live longer, better, and become smarter and stronger. We'll do the deep dive into the research and hard work of putting it all together, and you reap the benefits.
So welcome back to the Wild Health Podcast. I'm back here today with Dr. Mark Goodman, our Wild Health Director of all things sports performance, and the only person I can imagine considering bringing on the podcast to talk about glute activation. And as I'm saying this, I'm sort of realizing that the irony in the fact that we are sitting here recording this podcast on glute activation, completely not activating our glutes. I mean, just sitting here like I've got my hips bent at 90 degrees.
I don't know what you're talking about. My glutes are clenched firm right now. I'm activating.
We had hips bent at 90 degrees. Pelvic is like tilted backwards. Like I couldn't have any more flaccid glutes right now. So as I mentioned, Mark Goodman's here with me here today. And then I've brought on a person that's very near and dear to my heart because he's virtually responsible for the mobility that I currently have in my right shoulder. Denny is a physical therapist here in Oregon, and he's got a ton of experience obviously in physical therapy because that's what he does full time, but he's also got a lot of experience with athletes. He's traveled with Olympic teams. He's got multiple professional athletes on his schedule on a regular basis in multiple sports as well, right, Denny?
Yes, from pro baseball to snowboarders, skiers. We got freestyle cyclists that are constantly injured. It kind of all through the gamut, really.
And then you're a bit of an athlete yourself, if I'm not mistaken. Didn't you tell me you ran like a 2.5 minute mile at one point or something like that?
Yeah, so somewhere close. Probably add 2 minutes to that, maybe,
okay, yeah.
Or closer.
It was enough for me to be pretty blown away with the conversation. So you kind of know what you're talking about, and you know how to apply this information to the athlete is what I'm getting at. Would you say that you've got some experience with that?
Yes, for sure.
So Mark, you come to me on a regular basis talking about how the butt is so important. And I never really realized what you were talking about until
we call it the big house.
Until I started looking into some of this glute activation stuff. So can you give me a sense, and maybe you can help direct us a little bit with our conversation here with Denny on why this stuff is so important?
Sure. So, we were talking a little bit before the podcast got going, and I also work with Denny quite a bit in my sports practice, sending patients to these guys to work on not only glute, but, shoulder and all sorts of stuff. And I think one of the common themes in my job is not only trying to find what the problem is in a diagnosis, but figure out why that person got injured in the first place, and then figure out what we can do to not only get them better, but keep them performing well and keep them from getting their next injury. And when we do that, we have to really take a look at where they are biomechanically, and then look not only at their core strength, but, the thing that commonly comes up when we're looking at the knee is, you need to look at the hip and the back and everything that's more proximal to that as well. So when we're talking about the glute in particular, I run into this in clinic quite a bit when we see people that have knee pain, particularly like patellofemoral pain that is not kind of responding to normal treatment, or just patellofemoral pain that's caused by tracking of the patella abnormally that's often related to a weak glute or weak external rotators of the hip. So Denny's got some really cool tricks as far as working with these folks and not only identifying those problems, but then trying to figure out how to fix them. So Denny, when you're kind of looking at the glute, like what's your take on why this is important? And when you've been walking people through these long rehab protocols, what are you seeing as some common things in your practice?
Yeah, I agree with you. Like the patella tracking, the most common thing you see is poor glute medius activation. And the difficulty with seeing it is, the hip's not usually sore. So you're kind of like, oh, what does that have to do with it? But when people stand, the compensations can go three different ways. They could either drop their hip on one side, they rotate away from the injury, or they side bend away with their trunk. And those three things kind of contribute to the knee tracking inward. I always think of the glutes like the longer you're able to have hip extension and use your glutes, the longer you're going to be an athlete. And there's no other way to say it because that is what gives you stability. So when you think of core strength, you got to be able to be neutral in your lumbar spine while your hip is moving. And if your hip doesn't have good mobility or your hip glutes aren't working, then you're going to make up that range of motion either in your back, or you're going to compensate by letting your knee drop in. So glute medius, it's kind of on the side of your leg. And so when you stand on one foot, it keeps you level and it keeps you in the right position for really any sports. And that's also including like just straightforward walking or hiking. And then if your glute max is what propels you forward. And so if you're already crooked on your stance, then what happens, your glute max, it can't work right. So your external rotators kind of take over. And that's when people get like piriformis syndrome. And so it starts clenching down on the nerve going down your leg. And so one of our main goals always is how to gain hip extension by using the glutes and not getting it from like a passive motion when you're walking, say from your back, overextending or getting some other compensation factor. One of the first things I do is I'll just make someone just stand facing me. I'll get their feet about an inch apart and I'll just have them balance on one leg. And if you see a huge shift, you already know that that's the weakness. And it's so easy to see once you start looking at it.
And you mean like a huge shift in terms of like the pelvis tilting? Is that what you're talking about?
Well, it can, the tilt of the pelvis, there's, like a posterior tilt, like people do abdominals and they'll tilt their pelvis backwards or they'll tilt it all the way forwards. I'm not really talking about that because you could leave that part of your back almost in any position. But if you're too rotated backwards, you can't activate your glutes. That's why people, as they get older, they have that flat butt, right? Like you're like, oh, they can't even activate what's happening because they're staying in a posterior tilt because they lose the height of their discs. So when you start losing that height, you kind of have to stay a little flexed in your lumbar spine. So what we try to do is I try to get them to keep the hip extension because even if you're a little flatter in your lumbar spine, you could gain hip extension and then you could still activate your glutes down the road. So when you think about like even walking, running, pretty much any sport you're propelling yourself forward, your glutes are what push you forward. Your calf does as well when you're going uphill, but more glute than any other muscle. That's why we were joking around about the big house. That's your power muscle. That's the one you want.
So by hip extension, you mean sitting at a desk 9-10 hours a day with the hip totally flexed at 90 degrees, right?
Totally, the truck driver.
So, no, seriously, is that where this all came from? Is that why this is now a problem? Because we're all living these sedentary lifestyles at desks and sitting in front of computers. Is that to blame?
It's got to be a big part of it. It's what we all do. Like even when we don't want to, we're sitting writing notes or you're watching TV or something. Everyone's sitting more than they should. But you could even, you could walk, say, with your feet out in front of you and never even go into hip extension because it's not painful. You don't even know it's a problem. So some people have to just understand that they're trying to gain 10 to 20 degrees of hip extension just for walking. And if you can't, like if you step out in front, your ankles can roll, you're more likely to get knee pain because the only thing that can activate out in front of you is either your foot or your knee. So your quads can activate, but your balance will be off. Like if you just move slow and put a foot out in front of you, there's no way you could hold your balance. It takes the glutes to really hold balance. And the foot's a big part of it, but really it can't even activate well without being in the right alignment.
So what kind of patients or athletes are you seeing primarily that have trouble activating that glute? Are there certain sports that predispose people to not having good glute activation?
I don't know if it's, it can go across any sport, which is interesting. What I would say is a lot of power athletes like sprinters and people with quick twitch fiber, a lot of them are pretty good at activating glutes because that's why they're good at that. That's really a sprinting muscle. But the thing that people don't get is your gait and running slower still is a glute activation. Like Kenyan runners, their stride length will be 11 foot. They'll be able to push that far. If you tried to just reach out in front and do that with your calf, there's no way you could propel yourself that fast. So I look at it, our runners, like, the weird thing is you could be you could be pretty fast and you think you're doing it right, but if you really are activating your glutes and you train well, your miles per hour, you'll get significantly faster. And so I think that's one thing. And it's not just that I look at it in sports. Even at the Olympic level, I'll go with like the U.S. Nordic team, and there will be someone on the team with crazy VO2 max, but they're still not quite solid on one foot, which they have to be. And so then you're always trying to find out, can you fine tune that? And so you always think of the athletes at that level as strength training or as hard as you can imagine. But really the stuff they like is the little control stuff and learning how to move to make that glute activate as good as they can.
That's a really good point. So those athletes at that level, they're focusing on minute control movements like glute activation, hip extension, things like that. A lot of the times with you, at least, and with their trainers, rather than focusing on like really big, strong, powerful movements. Is that what you're getting at?
For sure.
And when you say hip extension, just to make sure everybody's clear on this, we're talking about when the leg goes back behind the body. So if you imagine that sprinter, they've got one leg like way out in front, they're getting ready to push off on their toes, and that back leg is just like 15 degrees back.
It's probably even
negative.
more on a sprinter.
Yeah.
And what's hard to see on a sprinter is their feet are still landing underneath them. They're slightly leaned forward. But really it's just enough to activate their core musculature. It's sometimes it's negligible on what you see. But when you're running, they're going so fast, it's hard to see where their foot strike is, but it really is underneath them. It may be, a few degrees forward because they're slightly bent at the hip when they're running, or you're got that downward kind of leaning posture. But it's definitely not reaching out in front of you. That's how you get it. So it's not so much of that you're kicking your leg behind you, that you're using your glutes to propel you forward.
Right. So the point being that if your foot is striking under your body, then all the force, or a lot of the force, is actually coming from the glute, because it's that force going back behind you. It's with your leg in extension.
Yes.
Yeah. Okay.
And so people that don't use their glutes, say with walking or running, they have a lot of vertical displacement, so they're using more calf than glute. And you still use your calf, don't get me wrong, but if you're propelling yourself really forward, that's a glute activation. So sometimes I'll try to teach it, and you'll just see someone just bouncing up and down, and you're like, whoa, that's not it. And you're trying to change what they're doing. Now, if you're going uphill, then you got to use more calf because you got to elevate yourself. So it depends on what kind of terrain, but on flat ground, you shouldn't have that much vertical displacement. You should just be pushing yourself forward.
And so when that glute's not firing and you're, in running, maybe getting that vertical displacement, what are you seeing then as a downstream sign of that glute not working that's maybe manifesting in other parts of the body?
Well, one, people will get more ankle sprains right off the top, because if you land out in front at all and you're not pushing, your ankle's floppy, as you know. So when it gets underneath you, it gets pretty solid. And then the biggest one is what you mentioned at the beginning, is knee pain. The knee pain is classic for poor glute medius control and poor glute activation. And I think that's probably the most common thing we see. You do get say hip tendonitis or bursitis, which we probably should go into.
I'm not sure that's really a thing.
Yeah, right.
Well, the tendonitis I think is a thing.
Yeah.
The bursitis, I'm not sure that's a thing. But we can talk more about that.
But I think that happens in medicine, right? You get some generic thing, right?
Sure.
And everyone wants to name one thing. And so it's easier to name bursitis because you don't quite know which tendon it is, versus say, I'm going to call it glute medius tendonitis or piriformis tendonitis or one of the other rotators of your hip. It's rare to see like a glute max problem. That has to be almost like a high force trauma. And that's the way big muscle groups are in general, right? Like you don't really, you get sore in, let's say, your pecs or something from doing bench press or push-ups, but it's hard to injure that muscle. You'd have to get yanked from a boat or something, or like something really significantly hard.
I'm pretty confident I injured my glute max at some point recently. My wife, Brittany, had me do this.
Can we hear this?
Twerking?
I wasn't. Let me tell the story. So it was some really aggressive twerking. No, she had me doing these hip thrusters with a band on my knees to like force, basically like a sort of external rotation of the legs with a hip thrust. Weighted with a barbell over my hips with like 185 pounds on it or something like that. And it didn't feel that bad when I was doing it, but I literally like rolled out of bed the next day. Like there was no activating my glutes. They were so angry at me. Yeah. Like I was just like hunched over, couldn't like get my pelvis forward the next day. It was ridiculous. So I'm confident you can injure your glute.
Yeah. How many days of recovery though?
Oh man, God, like 5 or 6. I think it was pretty good.
That's pretty good.
It was pretty good. I mean, I probably had rhabdo. I wasn't paying attention to the color of my urine, but there was probably some rhabdo going on, and probably proof that that I'm not appropriately activating my glute. If one workout can give me that much tenderness and that much pain, right? I mean,
more than likely.
And I have been known to have a flat butt, so I guess that's part of my problem. Maybe can we just tell if people don't activate their glute based on the flatness of their butt, Denny?
Yes, you definitely can, and you could tell when they fall easily. You could tell like if their balance is poor. They got poor glute activation and glute med activation.
So like if we just send Mike out to the gym and we say, you should just go do a bunch of squats, is he going to get his glute stronger? And I guess not just his glute, but the glute medius, which is probably the one we're maybe more concerned about. The glute max certainly important, like you were saying, is a power generator, but for some of those fine movements and preventing injury.
Yeah. So, a squat won't quite get the glute medius.
Have you seen Mike squat?
Yeah, I have not, but I think he could probably get it activated, but most people can't. So you got to like move sideways. That's the difference really. I think the one thing I always think about is like the older we get, the more linear you move. You don't tend to, I'm always joking around like we don't play tag anymore, you're not moving sideways unless you're doing a sport that makes you do it. So if you're moving more linear, a lot of times once you're weak, you never activate the muscle. Now, once you get it strong and say you're walking and your alignment, like whenever you step, you're tall on the weight bearing side. So when you get tall through that side and you're not shifting or rotating very much, you're probably activating the glute medius. But sometimes people are so weak, I can't change walking. I can't do anything. I got to be like, put bands around their ankle and just make them walk sideways until they fatigue. And then they're sore like you for 5-6 days sometimes. Like if they're really weak, it takes you by surprise sometimes how weak people can be there. So squats will get you stronger though. They're something about a squat too, when if you just do squats, you're going to get an overall strength increase, but it won't necessarily make your glute medius work better. So I do think that we should bring this up. We're talking about two separate things, right? Glute medius is what gives you the control and keeps your pelvis in the right position. Glute max is the power muscle that pushes you forward.
And, I still remember looking in cadaver lab, a long time ago. And if you just look at the size of these muscles, like the glute max versus the glute med or the glute minimus, you can kind of tell which one is giving you more power. The size of these muscles are significantly different, and the amount of force they generate is also significantly different as well. And looking at the major kind of external rotators of the hip, I think glute med is kind of be one that we're going to focus on more for someone with patellar tracking issues or something like that, as opposed to G-max. But what's your take on that? When you see someone maybe with knee pain or patellofemoral pain,
it's more likely. So the glute med is, it's more of a lateral muscle. So it's not really designed to rotate your hip like the other ones. What it does is when you stand on one foot, it keeps your hip from dropping. It keeps it from rotating, but it doesn't say rotate your femur. So glute medius is for the control side of stuff. So think of it this way. You got muscles that are made for control, meaning that like when you talk with your hands or something, your hands are in control of what you're doing. You're not just flopping around. So that's what kind of controls your positioning. Your glute max is the power, right? Like that's the propeller that moves you forward. So when the glute medius is weak, you're more likely, because you can't control where your pelvis is, your knee's more likely to turn inward. you're more likely to drop your foot inward. You're more likely to get the injuries that you're talking about. And also, the bursitis, which we started to talk about, like when you're using other muscles to try to control what that femur's doing, because you got to realize the glutes go from your pelvis to your femur. And if they can't control it, other ones are trying to take over all the time. So then you're more likely to get a tendonitis of something else. And that's what I think you see with it. And typically you got knee pain, you strengthen glute med, you get way better without doing any quad strengthening at all.
And in my clinic, this is something that, I'll stand someone up, and someone with knee pain, especially the classic one is kind of a younger female athlete that maybe has an exaggerated Q angle, or kind of the angle between their hips and their knee, and you have them do a single leg squat. And man, you can just kind of see things fall apart really quickly. And you can watch that inward collapse of the knee, and from that kind of deduce that the glute is maybe a culprit. And so it's something that I think sometimes patients takes a little bit of convincing that maybe the problem isn't actually with the knee. It's something that's causing the knee pain that's actually proximal to that.
Exactly. So when you look at a single leg squat, you just have someone stand there, squat. If their knee goes in, right, you look at, okay, is it from the hip, from the foot, or really the VMO as well, right? Like the VMO is the inside muscle of your quad. I think that can affect tracking as well, and then the rest is tightness issues, but usually people have pain before they get into any tightness. So you're kind of, you're kind of left with glute medius and foot problems for what really causes your knee to drop inward. Once you fix those, your pain really subsides.
So if I'm one of our listeners at home and I'm trying to figure out if I don't activate my glute appropriately, how can I sort of test myself to figure out if I've got some glute medius activation problems, or if I've got some just glute activation problems in general, I guess?
Yeah, I think, two things. One, glute medius is different than the glute max, right? That's what we're trying to say. So if you stand with your feet together and you just put your hand on your finger, pointed in towards your belly button, and you stand and you see a big shift away from that finger, your glute medius is weak. Now, women, if they have a wider pelvis, they're going to shift maybe an inch, but most guys won't shift at all. That's what the glute medius holds you. It holds you from shifting. And everyone's like, oh, don't you have to shift a little? You're going on one foot. But you got to realize the femur goes into your pelvis. So it is over your foot just when your feet are together, unless you really have some structural problems that I'm not aware of.
Hold on. So let me think about this in my head again. So I'm standing up on 2 feet. Yep. I put my finger pointed towards my belly button.
Yep.
And then I pick up 1 foot.
Yep.
And then if I see a shift,
so you'll shift, drop, or lean some way. Like if you can't pick it up and stay in a straight line, your glute medius is weak.
All right, so I'm going to try this real quick.
Okay, I like it. Yep. So
I've got my finger right at my belly button, and then I'm just going to
stand. So right side, pretty weak. See that shift? So you shift, not only did you shift, but you rotated away a little bit, right? So that's glute medius weakness on your right. So do it on your left side, you'll be pretty solid there. Better for sure. But now you're kind of shifting a little, but you didn't get that rotation away, right? And I think this is one reason why it's hard for people to tell. But one thing that I'm always like when I think of myself, because I don't work out like I used to or do all the stuff I want to do like in my head. So I always have glute medius as part of my training. Like I just hook the band around and I walk sideways. Put it around your feet, walk sideways. And I think that's, when you look at what gets injured in the body, it's usually the control muscles that are not working well. Like I said earlier, it's rare to injure a big muscle group, like what maybe we'll talk about at some point, the shoulder, it's rotator cuff muscles. It's not you don't hurt your deltoid hardly ever. So same with that. So I just kind of incorporate it, but most people, if it's really weak, you really see a shift when you stand. Now, the glute max, it's hard for people to tell when they activate it. So if you think about everyday life, like say just walking around, you don't ever feel muscle on unless it's hard. So people don't know that they're not activating it because something's pushing you around the house, or whatever. But I always have people just stand holding on to the wall, and the leg closest to the wall, I make them try to swing that backwards, like away from you. So away from, not up like you're stepping up a stair, but like you're pushing off. And I just try to actually turn on the glute over and over again until you learn what that firing pattern feels like. And then I have people try to use that same muscle to push them during walking. And it's a process for sure.
So just to clarify, so you're basically putting them into extension or having them extend their leg back behind them continuously to activate that glute, the glute max, right?
Yep.
And then for the glute medius, you're typically putting a band on around their ankles and having them walk sideways.
Yes.
Basically.
Yeah.
Just like low weight, low force, high repetition, sort of continuously moving sideways.
Exactly.
And then I seem to remember you telling me at some point you have to be careful about pelvic tilt when you're doing that. Like don't you have to also like make sure your pelvis is staying fairly straight, or maybe tilt is the wrong word, but there was some like little caveat.
Yeah. And I try to fine tune that with people because it's tricky to know, right? So as you get older, you lose that ability to move your pelvis either in that posterior tilt, like the flat back, versus anterior tilt where you get a bigger arch. So always think of joints like they work better from neutral. So like if you left your elbow straight, it would kill you because that's what a lock joint would feel like. So if you left it flexed all day, it would start hurting as well, but you could leave it anywhere in between as long as you want. So think of like the pelvis, like if you are rotating forward, say trying to get a little arch in your back, if you feel a joint locked, you're overdoing it. You just don't have that anymore. And so I always try to go as far forward as you can because if you could keep a little bit of arch, your muscles are going to work better. Some people, it's too late. They just lost too much disc height, and it is what it is. And then they're naturally a little flatter, and then you have to gain range of motion into hip extension to activate the glutes. So your glutes don't really activate till your leg starts going behind you. So a lot of people don't even have the range to activate the glute. And that's what happens with us sitting all day. We need, that's the truck driver syndrome, right?
So the other day I saw Mike at the 24-Hour Fitness, and he was doing that kind of clamshell external rotation machine. I think he was on probably his 10th set. I mean, he was just crushing it on that.
Yeah,
is that good for glute medius? Or
solid 30 minutes into that thing.
Yeah, I mean, it looked like he was probably in zone 2. He was more of an aerobic work.
Yeah, I hope that's on film because I kind of want to see that. But the interesting is not as much as you think, because when you're flexed, because those machines are usually you're sitting, right?
Yeah.
And you're flexed forward. So then you end up getting your TFL more. You end up getting not quite glute medius. And then if it is, the part of the glute medius that you get is more of the anterior fibers. So you're not really getting the posterior fibers as much. But it's not like, it's still okay. It's just not what we're doing when we stand, because at standing, you're going to get more of the lateral and posterior fibers.
But if you're looking to kind of maximize the time you're putting in and find a functional way to activate that glute, it sounds like that's probably not the best way to do it. There's some other things you could do.
Time-wise, if you could get a band, put it around your ankles, walk sideways, probably the quickest. I still, like if you're at a gym and they don't have it, most of them have a cable machine. But you got to keep yourself straight, because really the glute med is activated on the leg you're standing on. So if you hook it to your leg and move your leg like lateral or sideways to you, it's going to activate both the leg you're moving and the one you're standing on. But if you start twisting or leaning, then it's going to turn into like a quad or just a different exercise. So you get, the weirdest thing with glute med is you got to be really picky about holding your posture straight. And so that's probably what you were alluding to earlier about your pelvic position. Like if you're not straight, or if you're leaning or twisting, then you end up activating more quad and less glutes. So like your patients that you see with knee pain, they're more quad dominant. So it's rare that they're weak quads. Like you look at them, you're like, whoa, you are strong. And then they're like, why do I got all this knee pain?
Yeah, that's been my experience too. You
Yeah.
know, some people have tree trunks for quads, but their knee still hurts, and a lot of anterior compartment knee pain can be traced back, I think, to poor glutes.
Yeah, exactly.
So if we're talking about the glute and kind of overuse injuries to that area, I think we have to kind of get into trochanteric bursitis or lateral hip pain, which is kind of a black box in my sports medicine world because there's so many things that can cause lateral hip pain. But one of the most common seems to be this greater trochanteric pain syndrome or trochanteric bursitis or glute medius tendinopathy. And I think there's some overlap probably between all those, and maybe they're all the same thing. I'm not quite sure. I'm trying to wrap my head around that still and trying to figure out the best way to approach these people. I think, from my perspective, PT is a huge part of that. So maybe hoping to get your take on what you think about these and your thoughts on whether they're the same thing or all different entities.
Yeah. I mean, I could tell you countless stories of ones that you fix a little different ways. But I agree with you. I tend to call it a tendinitis because of the way we fix them, like it's usually you're really strengthening the glute medius a lot is what you end up doing, but you're really picky about how you strengthen it because people don't even realize that they're compensating. So everything that we've been talking about, people are like dropping their hip or rotating like we just saw Mike do. You don't know that you do that until someone points it out. But then once I think of things like once you get hurt, then the way you move keeps you from healing. Like the analogy I always give like if you get a cut on your face, if you pull it apart every day, it's not going to close. So even though people will be like, oh, I move like this forever, you're like, okay, yeah, but now you hurt it. And every time you step like that, you're re-tearing that glute medius fiber. And so I'm always trying to make it work more correctly where they don't get that like rotational force on those fibers. And if you could do that, usually they heal up. And then we do tricks to make them heal. Like we do the dry needling, which is just no medication to get, like if you did get some scarring, it breaks it up or it gets rid of tightness somewhere else that might be causing the glute not to activate. But there's all kinds of little tricks, but usually it's gaining hip extension and strengthening the glute. It's more of like the glute medius has to hold you still, strengthening the glute maximus and getting hip extension. So those three things.
That's kind of been my experience as well. And I think now using more and more ultrasound in clinic diagnostically and starting to look at some of these, and what I find more often than not is there's really no fluid in that trochanteric bursa. If there is, there's just a really small amount. But what you will be able to see is some diseased tendon or tendinopathy at that glute med, and that's probably the most common thing with that lateral hip pain. So I've kind of moved away from calling this trochanteric bursitis and called it more kind of gluteal tendinopathy. And I think it does guide our treatment maybe a little bit more, because when we treat it like a tendinopathy, you go down the road of doing PT, maybe doing PRP, dry needling, some things to stimulate healing in that area, which can be useful, as opposed to doing a corticosteroid injection, which is what we used to do. And I think the recurrence rate after a steroid injection was pretty high in my experience, unless you correct the underlying kind of biomechanical factors that got the person there to begin with.
And this has been awesome, guys. I've learned a ton. I think now might be a good time to summarize a little bit and maybe to ask one more question. So first off, your butt is important for lots of reasons. One of them is to prevent pain further down your legs, so your knees, your ankles, your stability. And it requires you to be able to extend your leg back behind your body and to activate your glute medius and your glute maximus. And the glute medius is important for sort of stabilizing your body in general, but mostly your pelvis and your femur. And your glute maximus is sort of the powerhouse. That's the thing that Denny was talking about that's so strong. It sounds like the best exercise, if I might say so, it sounds like what you were saying, Denny, is to activate the glute medius is actually to put a band around your ankles and walk sideways. And the best exercise to activate the glute maximus, not necessarily for strengthening, but just for activation, would be kind of holding your hand up against a wall, standing sideways against a wall, and then the leg that's closest to the wall, kicking it back behind you into extension, right?
Yes, I would agree, because I'm looking more at how you use it functionally, because if you don't use it every day functionally, it just gets weaker. And so that's why like everyone can think of 50 different exercises for glute max. People are doing like what you did in the gym, and it definitely works. But if you don't use it functionally every day, it just gets weak again.
So I just get real good at doing hip thrusters with a barbell on my hips. Yeah. But not necessarily activating my glute when I'm running. Yeah. Yes. I see what you're saying. So if there were like one thing that I could do prior to going for a run, say, or going skiing or whatever time that I want to make sure I'm activating my glute, what is there like, like a drill or something that I can do to actually like get that thing firing?
Yeah. I mean, I like doing like what I was talking about earlier, like just hip swings. So one, like this swinging your leg backwards without your back going into extension, then you keep your range of motion in your hip, which you need for the sport, and you're able to activate your glutes. So it just teaches you to keep using it. But really, like when you run well, or you're, whatever sport, you're trying to activate the glutes. The glutes are what's moving you forward. So there's definitely sports like, say, skiing, where you don't have to go into hip extension. So a lot of people, like that one gets you strong, but you don't have to get the hip extension. Hip extension is more for sports that you're propellant forward. So there are sports that you don't need. They need to get activated and be strong, like a squat. Like you were saying, like you could go to the gym and do squats, you're going to get a stronger hip. And you use that in sports like skiing and things like that, where you don't have to have the extension. But functionally, the extension is what keeps you out of trouble.
Awesome. So 2 ideas. One, Denny, will you come back and talk to us about the shoulder? Because I think we could maybe get at kind of some similar stuff about the shoulder.
Yes, yeah. which does have a lot of...
The shoulder's the new hip.
I've heard shoulders.
It is really hip.
And then 2, I think we should record a quick video of Denny sort of showing us what he means about how to activate the hip and how to figure out whether you've got poor glute med activation. So
yeah, that'd be great.
We'll record that, put it on Instagram, and we'll have you back hopefully soon for the shoulder.
Sounds great.
Awesome. Thanks a lot, Denny.
You bet.
We hope you like listening to the podcast as much as we like making it. If you think it's valuable, share with somebody. Send to someone you think would really benefit, and leave us a 5-star review in iTunes. Those reviews really, really help us out. Find us on Facebook and follow us on Instagram at WildHealthMD. If you didn't like, well, why are you still listening? Email us and let us know what we can do better. But the best way you can thank us for our time is to leave a review and share. Until next time.